Hello, welcome back. Dr. Egey-samu here. Last time you were in the practice, we took an X-ray and a nerve scan and did an evaluation of your spine. We did those things, number one, to determine, do you have subluxation or are you in the right place? The other reason that we took those X-rays was to see how long the subluxations have been present in your spine, or how do we help you get better. So let's get started. Now, categorically, subluxation is graded as healthy normal, phase 1, phase 2, and phase 3. The one thing that you'll notice here is how the discs, the bones, and the nerves look as we progress through the categories of subluxation. You'll notice swelling on the disc, deterioration, bone spurs, nerve pressure, discs gone, and nerves obliterated. The phases of subluxation don't tell us how severe the problem is. It simply tells us how long it's been there for and how long will it take to correct it. Before I get started, one of the most important concepts that we can get across to you is the idea of health. The World Health Organization defines health as the optimal functioning of your body mentally, physically, socially, and spiritually, not merely just the absence of disease or sickness. The most important word here is function, and function is significantly influenced by your nerve system. So to get started, we're going to start with a normal, healthy cervical spine. I'm going to get you oriented. This is the back of the skull, there's the jaw, and the person is facing off to my left. We have a nice cervical curve, and chiropractors, neurologists, health experts around the world will describe this as the arc of life. It is literally the most important curve in your spine. It provides cushion and proper tension on your spinal cord. Now, within the spinal column, you're going to notice that the head is over the shoulders. The head is nicely suspended. It has 7 cervical vertebrae, all separated by a disc. And the disc's purpose is to create the spacing here for the nerve to exit out. The top bone in the spine, and this is an important number, is 18 degrees. The cervical curve, this arc, should be a 45-degree angle. And the head forward posture should be less than 1 centimeter for a 10-pound head. When the spine shifts out of alignment, oftentimes because of traumas from things like sporting accidents or water sports or slip and falls, but it can also occur with things like laptop use or being on your cell phone. All these things will slowly shift your spine out of alignment. So it can be abrupt or it can be slow. When it shifts out of alignment, you have phase 1 subluxation. Now again, we have normal healthy to the side here with the curvature showing the green where the spine should be. Here, you see where the spine has shifted to. Head is no longer over the shoulders. The head is forward. There is now tension on the discs, on the spinal cord, but most certainly the nerves. However, this person may or may not have symptoms. If it's left here, gravity and time work negatively on the spine. This is an MRI image of a spine that's shifted forward in phase 1 subluxation. You can see the spinal cord tissue here, and then right here below the brainstem, which is right here, there's significant tension causing pain and pressure and symptoms for this individual. This person has had this condition for between 5 and 7 years. Uncorrected, we'll move into phase 2. Phase 2, subluxation degeneration. And here there is 7 to 15 years of breakdown. Again, normal healthy, the green line indicating where the spine should be on both images, and the red line indicating where the spine has shifted to. What's the first thing that you notice? Exactly. The head is shifted forward, there's loss of proper alignment within the spine, and you're noticing deterioration. The deterioration seen on this section of vertebra, these are osteophytes or syndesmophytes, also called a degenerative joint disease or degenerative disc disease. Now commonly these are all categorized as arthritis, inflammation within the tissue. This person has had this issue for 15 years or more, and this person for sure has symptoms. When you look at the side view of the spine here, you're going to notice that there is a breakdown in the tissue, and this is correctable. We can get this person out of their symptoms. The areas that are degenerated will remain. but we want to make sure that it does not progress any further. So correction, of course, will take between 1 and 3 years. Left uncorrected, we move into phase 3. Now phase 3, what do you notice here? Again, total shifting, total malalignment of the spine. The atlas bone is now encroached upon, it is dropped down. The angles of the curve, we can't really calculate because the spine is so out of alignment. The green, again, still indicating where the spine should be. The bones are no longer stacked up properly. The discs have deterioration and arthritis throughout. And most importantly, the spinal cord inside here no longer has the proper tension and communication that it needs to run and organize your body. This is phase 3. Unfortunately, not correctable. And as a doctor, in this practice, it's troubling to us because this person has literally been seeking for decades the cause of their issues, only to find out that their spine has been misaligned and putting pressure, damaging pressure on the nerves within the spine. It's not correctable. Our goal with this person is to relieve their pain, is to get them out of pain, is to make sure that we stop the progression of the arthritis, to reduce the inflammation. This is phase 3, and we help people like this all the time. When you come in for your next appointment, there's 3 questions that you're going to want to know. One is, did you find subluxation in my spine? Can we help you? Number 2 is, how long has it been there for? How long is it going to take to correct my problem? And number 3, how do we get started? How quickly can I get adjusted so I can start correcting the problems in my spine? On behalf of the entire team, we're really looking forward to seeing you at your next appointment to review your x-rays, to talk about the plan, to talk about the path, to help you reach your goals for you and your entire family.